Perioral rejuvenation has always been part of facial rejuvenation. However, I think recently, over the last 10 years or so, patients tend to focus on specific areas of the face, and the perioral area is one. Anybody that has wrinkling around their mouth and is disturbed by it would be a candidate for perioral rejuvenation. And certainly the treatment for an individual patient has to be tailored to their particular problem. There are all degrees of perioral aging or perioral and perioral improvements that we use. We have a number of options in our little bag of tricks that can help soften and improve this area in a very natural way. For example, the commercial fillers would be a very quick procedure done in the office. Essentially no anesthesia is necessary, and it would take anywhere from 10 to 15 minutes. There is no downtime essentially with the fillers. There can be some bruising, but typically the bruising is very easily covered with normal makeup. So someone could have a filler in the afternoon and go out that evening typically. Fat grafting around the mouth is a little more involved. It may or may not involve a twilight, a light anesthetic. Some people do it under straight local, but it would involve probably about an hour in the office. The recovery with fat, though, also is like the filler in that it's very quick, minimal bruising. Any bruising that you do have could easily be covered with makeup, so the next day you're ready to go. The peel, however, is probably the quickest procedure to do. It's just painted on with a Q-tip, but it does turn the skin raw, and that skin is mildly raw for about a week. It needs to be covered with Vaseline or an ointment during that week. At the end of the week, the raw area is healed, the new skin is somewhat pink, and that pink skin stays pink for about several months, 2 to 3 months. Easily covered again with normal makeup. I think all of these procedures that we do and talk about really are prefaced by educating people on proper skincare. And no matter what we do, whether it's surgery or the non-surgical procedures such as fillers, Botox, chemical peels, all of them will be enhanced, and the longevity will be increased with proper skincare and proper skincare knowledge. And that comes part and parcel with a consultation with us. We have a whole skincare division, and we encourage our patients to have a consultation. We analyze what they use and what they don't use. We're not trying to sell them a bushel full of products and send them out the door with things that they don't need. That isn't the case at all. Really what we like to do is analyze what they are using, and perhaps we would substitute something for one of the things they are using, maybe not. But what we're trying to do is develop a program and a rationale that makes sense for them and has some basis in science.